Mr. Long?
Here.
Mr. Matheson? Mr. Payne?
Here.
Mr. East?
Here.
Mr. Carlton?
Here. We can stand for a moment of silence. I ask Mr. Long if he would to say our pledge. Mr. Long.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, the first item on the agenda is the election of chairman and vice chair. We do this every September, and we're going to turn the meeting over to Dr. Simcox.
Okay, at this time, I'll entertain a motion for chair of the Johnson County School Board for the 2020-2021 school year.
I'd like to nominate Howard Carlton as chairman.
Second.
Okay, I have a nomination and a second. Ms. Lickford, will you call the roll?
Mr. Long?
Yes.
Mr. Matheson?
I refrain from voting.
Mr. Payne?
Yes.
Mr. East?
Yes.
Mr. Carlton?
Yes.
Congratulations, Mr. Carlton. I will turn the meeting back to you.
All right, we'll open the nominations for vice chair.
I nominate Mike Payne.
Okay, we have a nomination for Mike Payne.
Second.
All right, we have a second. Any other nominations? Call the roll, please.
Mr. Long?
Yes.
Mr. Matheson?
I refrain from voting.
Mr. Payne?
Yeah.
Mr. East?
Yes.
Mr. Carlton?
Yes. Okay, congratulations, Mike.
Thank you.
Next item is recognition of any visitors or delegations. All right, doesn't look like we have any. If I look like I'm holding my nose, it's because I'm trying to see through the fog of glasses. Next item is the consent agenda. Is there anything on the consent agenda that anyone would like to pull off? If not, we'll entertain a motion.
I move we approve the consent agenda.
Okay, Mr. Long's given an approval. Is there a second?
I second.
Mr. Payne, second. Is there any discussion? All right, if you would, call the roll, please.
Mr. Long?
Yes.
Mr. Matheson?
Yes.
Mr. Payne?
Yes.
Mr. East?
Yes.
Mr. Carlton?
Yes. Next item is a report from our student board member, Lauren Patterson, and I believe Dr. Simcox has her report.
I do. We had invited her to come tonight if she felt comfortable. So, the first month of school has flown by. Though faced with challenges adjusting to the online platform, many students have done an excellent job keeping up to date with their work by checking their emails and Google Classrooms daily. Last Friday, our football team played the first home game of the season, even with social distancing guidelines for the audience. On Wednesday, September 16th, the National Honor Society is hosting a blood drive at the Johnson County Community Hospital. Please support NHS by calling to make an appointment. Seniors, be sure to check for your ACT day provided by the school. If you haven't picked up your Jumpstart Practice ACT books, please go up to the school and do so. For those who finish all the modules, there will be a drawing for 2 seniors to win $100. Prepare for the ACT and have a chance to win some college money. Also, remember to order a yearbook for this school year, either through a pamphlet mailed to you or online through Jostens. Yearbooks are only $60 until October, so get it cheap while you can. Keep up the wonderful work, students, and be sure to reach out to staff if you ever need help or have questions.
Okay, thank you. Next item is second and final reading of the TSB recommended policy changes to the 3 policies: suspension, expulsion, remand, alternative school programs, and child abuse and neglect.
Yes,
Dr. Simcox?
On 6.319, which is suspension, expulsion, and remand, the TSBA updated the entire policy to align with state board regulations, which clarifies that students who do commit zero tolerance offenses can be suspended and not have to be placed in alternative schools. With suspension, it added 2 reasons to be suspended, one being marking, defacing, or destroying school property, and another one being when a behavior possesses a danger to someone that disrupts the educational process. And then with the last one, with reporting child abuse, the General Assembly requires us to designate a coordinator at each school, and we do have those at each school designated.
Okay, is there any questions on this? This is for a vote, since it's second reading. We have a motion.
Yeah, I'll make a motion that we approve all three of these. Is there,
Okay, Mr. Payne's made a motion. Do we have a second?
Second.
Second by Mr. Long. Any further discussion? We would call the roll, please.
Mr. Long,
Yes.
Mr. Matheson,
Yes.
Mr. Payne,
yes,
Ms. Reese,
Yes.
Mr. Carlton.
Yes. Next item is the 5-year plan update.
Yes, just to let you all know, the 5-year plan has been posted on our district website. So we're going to touch on each one of our 5-year plans for every meeting, so.
Okay, so if families or teachers or staff or anyone else wants to see that,
They just go to the district website at www.jocoed.net, and it's on the home page. And I think
Okay.
it's also under the school board.
and we did try to make that a little more detailed.
Yes, it is more detailed.
how's the technology committee coming along?
We are looking at ordering inventory, a way to inventory our technology equipment. So they have been working on that. We'll have an update for you on the October meeting
Okay.
about that. Because we're trying to purchase that with some CARES money, so.
Next item is permission to sell and declare a surplus a 2001 straight drive bus.
I'm going to turn that over to Dr. Long.
Yeah, we do have a, I guess you just read, a 2001 straight drive bus still on the lot at the bus garage. That is a remnant from something that we used to use for testing. And it is, we can't use it, we don't test anymore. There's really no reason to keep it, so we would like permission to sell it. If you have more questions about the bus specifically, Mr. Carver can answer those for you.
Okay, do we have a motion on this item?
Yeah, I'll make a motion that we allow to sell this bus.
Okay, Mr. Payne's made a motion. Do we have a second?
Second.
Mr. Long has made a second. Is there any discussion? All right, if you would call the roll, please.
Mr. Long,
Yes.
Mr. Matheson,
Yes.
Mr. Payne,
Yes,
Ms. Reese,
Yes.
Mr. Carlton.
Yes. Next item is a budget update from Ms. Lipford.
The 2021 budget for Johnson County Schools has been approved by the state. We received notification of that this week. You have a big packet here showing all the budgets for general purpose, central cafeteria, Head Start, federal projects. You also have your packet of information from Mr. Robinson. The school department at the end of August was 8.8% revenue received and 10.26% of appropriations expended. Revenue for the month of August for general purpose was $1,555,170.95. Expenditures for the month of August for general purpose were $1,290,024.01. The majority of these expenditures were salaries and benefits. Sales tax collections, they were received in August, but they were for the month of July. They were $193,424. Collections were up $26,619 from the prior month and up $33,078 from the same month in the prior year. No property tax collections were received, and just remember that the sales tax numbers are before the split has occurred. So sales tax is coming in strong.
Any questions for Tina? All right, we appreciate you doing double duty. All right, the next item is to discuss and approve additional paid leave related to the Families First Coronavirus Response Act. Dr. Simcox?
Yes, this is something Ms. Lippert and I wanted to bring to the board's attention. Under FCCRA leave, which is a federal leave for COVID, employees are entitled to 10 work days to be paid for. They don't have to use their sick. After that, if they have to require more time off, then they have to either use sick leave, vacation or personal if they have it, or take time off without pay. When Tennessee changed their guidelines probably about a month ago, and they extended if you're in isolation, not if you've tested positive, but if you live with someone who has tested positive, you have to be isolated for 24 days. that goes above and beyond what FCCRA allows us to do. So we just wanted guidance on how to proceed with that. You know, right now, for those that are doing it, we're just having them use their sick leave if they have it. If not, you know, it is unpaid leave because we're having to follow the FCCRA guidelines.
Have we had many that's had to use it?
Two?
Two, I think.
Two for the 24. That's so far.
You're saying if we approve it, will it come out of
Reserves?
reserves?
Well, we
Yeah,
have some money in ESSER for this. Not a lot, though, because at the time when we put money in ESSER to cover, you know, leaves, they had not went to the 24-day isolation. It was,
The governor said something today. Did he change anything?
I did not
I
get
was
to
on the
listen.
road, didn't get to listen.
Part of it, it didn't, no, they just like had some general questions, they didn't really say anything about schools or anything, or that.
Do they have a choice? I mean, if you live with someone who's tested positive and you have to stay at home for 24 days, correct?
Unless you're positive, unless you're positive yourself.
And
No,
then
that's mandated, that's the law, you have to do that.
you have to stay
that-
home
that
for
was not
24
optional.
days,
in Tennessee.
In Tennessee, that part's not optional.
even if you test negative. If
Even
you
if
go
you
take
test
a
negative.
test.
Because you are continuously exposed to that household contact.
So this critical infrastructure is not helping us now.
Not on the household contact part, it doesn't help.
No, it just helps with employees that maybe were in contact either at work or somewhere else, but not household contacts.
Well, essentially, I mean, even if it wasn't a law, you want them to stay at home. You don't want them to come to school, and then this whole effort that we've made is for nothing.
Yeah.
How would you fund that again?
Well, we have some money put back in the CARES Act that we had put to help cover, you know, leaves or unemployment, you know, those kind of costs. But again, like at the time that we did the CARES Act, we didn't know that they were going to change it to 24 days. So there's not really a lot in there to cover that. So we would have to pull that out of reserves. And again, you know, right now we just have two. So we don't know how many people we're looking at that this would impact.
Have you talked to anybody from other systems?
They're having the same problems.
So they haven't come to a decision either?
No.
But this would, I mean, other than being able, I know some of this COVID leave has been abused by people going and getting a test and then staying home for however many days and getting the COVID pay. But in this case, you would have a positive case in that person's household.
You would know it's possible.
Correct.
Right.
And the only other stipulation on that, we've not ran into this, if you have another, like we talked about last time, if you have another person in there that becomes positive, and say the teacher does it, it could extend it a little bit longer.
And they don't have a choice.
No.
No.
Not on that one.
They don't
We
have a
can't even
choice.
get around it with critical infrastructure, because I've asked.
And I have sent our concerns not only to the Department of Health, but to the State Department as well. And I know in speaking with Chris McCarty and other directors, they also are voicing the same concerns. Because this is not things we have budgeted.
Well, we haven't budgeted it, but the science behind it is basically the fact that you don't want them coming to school having coronavirus and passing it on. So what you're asking is, the board then is, does the board want to alter this for the people who are in that situation, which you would know they're in that situation because there is a positive case. This isn't just something where somebody's getting tested and sitting back.
Right, because we told the faculty if they want to get paid, or, you know, they're on that situation, then they have to call us, and I have to know the household contact.
And I know for me in Virginia, I can get the health department to send an employer letter that verifies that that employee.
They can do that here too.
And we
They do
have
that,
received
okay.
those.
So you would have verification.
And Wendy does get all of those. So we, you know, nobody could abuse this because it does have to come through Wendy.
So if you're gonna get it out of what's left over, what happens when we run out of that? You just come back and ask again?
We'd have to get it out of reserves.
You would ask before that happens?
Yes.
The funds for the employee are budgeted.
Right.
Those funds are actually budgeted. It's gonna be the subs that we have to pick up, that that we're gonna run into the need for
So
additional
that,
funds.
basically, that's all, what we're talking about, is subs and cooks.
Yes, because the funds are already there for the employee. If you chose to, say, continue to pay because they don't have a choice. But the funds where we're gonna run into a little bit issue are for the subs in different situations.
But we still we would have to approve for the employees to be able to have that.
Yes.
And if we have the employees, if we give it to the employees, then we would need to, I would think we'd need to be
Across the
fair
board.
across the board.
Just go across the board, yeah.
Now, on this sheet right here, it says that this goes through December the 31st. Now, if we do this, we're only approving, if we do approve, or this, it's going to be through
Yes,
December the
because
31st. Is that correct?
January 1st, they'll have to come out with new guidelines. Yes.
Exactly, what are we approving here? You get 10 days from the federal government, correct?
You get 10 days paid leave. What you all will be approving is, instead of an employee having to use their sick time because we have to by the state of Tennessee, if they're in isolation, they have to be out 24 days. So instead of them using their sick leave, they would still receive pay.
For the balance.
And then they have sick leave time, right?
Yes, but when they're in FCCRA, it doesn't touch their sick leave.
Do they have to absorb all of that before this would just take effect?
We have employees that don't have enough sick leave, so
To even
we
cover.
would give them the 10, and then the next 14 minus the weekends, they would be without pay.
But wait a minute, the 10 is for an employee who tests positive.
Yes,
So you would have to be positive, you would get that 10 days. This doesn't add on 24 more days to your 10.
no.
No.
The 24 days is for the employee who lives with
A positive
someone
person.
who's positive.
Yes.
Yes.
And through no fault of their own, I mean, if I go to the jail and I get coronavirus and bring it home, then my family would have to stay isolated
Yes.
Correct.
for 24 days.
Correct.
So there's two different. The 10 is for the employee who's sick. The 24 is for
Isolation.
our employees who, through no fault of their own, have to stay home. So I guess what I hear you saying is, does the board then want to take the action to approve to give these people leave?
They gotta use their sick time, then once they're out of sick time, we pay them, is that what it is?
Well, that would be your choice. I mean, you would either take on all of it, or, because the issue is there's a lot of employees that don't have
sick
enough
time.
sick
Right.
time to
That-
cover
that
those
bill,
days.
yeah, I
Yeah.
understand.
Hey, Howard, when you worked for the state, how did the state handle that? How would they handle?
We didn't have coronavirus then. You mean when I was here?
How would they handle that type
didn't.
of leave? Yes. They would give you, federal government would give you the 10 days, right?
Well, we didn't have coronavirus back then.
Well, I'm not talking about coronavirus. I'm just talking about if you had to take family leave. You had to take those 10 days.
What, 10 days? Because we didn't have
The
anything we
federal
were given
government
10
has give
days.
you for family leave time.
Now, I'm not sure how to equate that because there wasn't a 10-day leave back then. Now there
Yes,
is a
there
10 day.
was. Yes, there was. The federal government adopted that.
I don't
Sure
remember
did.
that.
You're probably talking about the family medical.
That's right. You're probably
That's
FMLA,
different.
which
Well,
is
yeah,
different.
If you're talking about FMLA, you use your leave first and then you go on
And it can be more than-
FMLA, but FMLA does not pay you. Once you use your leave up, FMLA just keeps your job. If you get short-term disability or workman's comp, they would pay you a portion of your salary.
Now, what does the state, how do they do it now?
I have no clue how Tennessee does it.
I'd say exactly the way they done it before. You use up your sick leave and use up your annual leave, and that's it.
Well, I realize that, but we're not the state, and we're the
Yes,
the
we
county.
are.
No, we're not.
Yeah,
We're
we
the
are.
county
We get
school
funded
board.
from the
And
state.
we're talking about our employees and the ability that we have to make that decision.
We get funded from the state, you know that.
We're not talking about them. You make that decision. The state doesn't make that decision on paying them. So my issue, I mean, not my issue, but my question is, what's the pleasure of the board for our, that's what they're asking, is some guidance from the board. Do we want to not do anything and people have 24 days and some of these people
Some of
would
these
have
people
to
will not
leave?
get paid.
if we don't do anything, what's the likelihood of someone, just not reporting and coming to school anyway? Because they can't afford it.
Very high, because Wendy's seeing that, yeah.
Oh, really?
I'm seeing it after we go through this other thing. I'll explain a little bit more why I'm seeing it too. But that's just a piece of it. And it may not even be 24 days. Now, most of the household contacts, I will say, the other ones are pretty much winding up positive. So that's shortening their time anyway. Because, technically they're 24, but then a couple more days where they've been around their family, household contact, they're contracting it anyway. So then it just winds up being 10 for them.
So basically, we're talking about, really work days too. You've got the
Yes.
weekends and
Right.
that come off of
Usually
that.
less than it. You're just, trying to do the full amount
Right.
initially, just because it could possibly be that way for some of them. And right, we've only had 2 so far.
Did they use the whole 24 days? Or, of course, you've got weekends in there, you have to have
Well,
weekends
no, they
that
wouldn't
you're
use the
not
whole
working.
24 days. How many would that be, Tina? Did we figure out it's be like 15 probably, because you've got the weekend in there.
Right.
Right,
It'll be about 3 weeks.
15?
Yeah.
Okay.
But if you got, I don't have a problem with it if we've got funds that they send us anyway
Yeah, and that's what we're
to use.
that's what we're utilizing right now.
For everyone.
And then when that's gone, if we come back, if coronavirus has gone away or if it's not, and we still come back and ask to extend that, that's fine with me, but I'd say to approve this coming out of the fund that you spoke about, and then come back when that money's gone.
So if you're making that in the form of a motion, would you also put in then that they use their personal leave first?
Yes. If they have it.
If they have, yeah, whatever personal leave gets used first, and then,
If they have it.
Now, I think I know the answer to this, but there's no way to use any unemployment on this if they're having to go, because it's medical, right?
Right, right.
Okay.
Well, can we set a limit on the number of days, like Wendy says that it's approximately 15 days? So if we say 15, and then the rest of it would be, most likely, it would run into holiday, or weekends,
Weekend,
because you'd have 6 days.
that's fine.
I'm just asking questions.
I guess if somebody got sick starting on Monday, that would be.
That'd probably be the longest, unless, they had multiple people in their home that continued to move it
Yeah.
up. some.
Extending
Extend it out.
it, that could keep extending
And
it.
it may come to where it's a case by case. and we
Right,
have to
yeah, and that's
look
the
at it.
thing, because it may be that if you had a person, they could be out 40 days, depending on
Yeah.
how they're,
How many kids
how
and
many
they don't
kids,
catch it.
and they don't
Right.
catch it, so, but that is definitely a case by case, and I think that would be a rare
It
incident.
would be, I think, too.
Yeah,
Okay.
well, one of your issues is gonna be that the asymptomatic folks, where they don't know that they've got it, but they've got it, and if you're not testing, you wouldn't know that they have it, so.
You got a motion written down?
I'm not sure which way we're going. Are we doing, like, I know Ms. Reese had mentioned 15, doing a cap,
Yeah.
and then,
I guess this is added to that original motion.
okay,
use the extra funds.
okay.
So if you wanna read that back, what we think we were voting on.
To make sure.
I like it, yeah.
Okay,
I mean, that gives them-
so approve using ESSER funds for the first 15 days of COVID-related
15 work days.
work days. Of COVID-related quarantine. Is there a specific name for the 24-day one, just a home contact quarantine?
Household contact.
Household contact
That's what
quarantine.
contact.
Okay. So approve using ESSER funds for the first 15 work days of a household contact relating to the coronavirus.
After their sick leave.
After the
Expiration.
FCCRA.
Okay, gotcha.
Would that include annual leave and sick leave if they have it? They
They
use
have
up?
it. They have it.
Those will be absorbed before you go into any additional funds, correct?
You talking about annual leave vacation?
Yeah, all leave.
Is that what you're saying, or
Yeah.
just leave in
Annual leave
general?
would be vacation, yes.
Is there something about vacation we have to allow them so many days?
We do have to allow them so many days.
We have to allow them so many days. That's the reason Christmas is the way it is. I think they get paid through Christmas, but
Yes. Is it 8? So,
So read back what you have.
okay, the annuals, all right, are we going to include the sick leave after
After
the 15 days? They would be responsible?
From what I heard you say, it would be, what I heard the other board members say is that they would expire their sick leave first. And then once their sick leave's expired, they would have 15
Would have 15
available
days.
work days.
Okay. Approve first
Yeah.
15 work days
we'll make sure we get
Does
that
that,
done
does everybody
correctly.
following.
understand? I think, well, I think it's helping our employees, and again, you know, we do want to,
But for
Help
those
them.
that don't have any sick days, and we do have several that will land in this boat.
this is extraordinary circumstances.
Right, because we do have several that will not have enough sick days to cover the 15
So if they
days.
have no sick days, then they go
Well,
straight
they've got
into the
15,
15.
they just have to
Okay.
expire. From what I heard everybody
All right.
saying,
Right.
they have to
Well-
expire their sick leave first.
Okay, approve first 15 work days following expansion of sick leave days
Is that good?
for household quarantine.
Since we have the money in the ESSER, could we not cover the first 15 and then let them use their sick days, since we're making them stay home? Because by law, we have to make them stay home because they can't come back.
Say that again?
Can we not, since we're going to cap it at 15 days, can we not say, since we're going to use the ESSER funds, you know, you've got your 10 days through FCCRA that's paid through the federal government, and then you have to be out, 15 more days. Can we not say we will cover those as paid days through ESSER, then after that 15th day, then you have to use your sick leave? Because we're requiring them to be out for 24 days. For the 10 days, we're paying them and not making them use their sick leave. And then we're saying, but you're going to have to be out 15 more days, but we're going to make you use your sick leave. I think that'll be hard on some employees, just to be honest.
Okay, I must have misunderstood, because I thought that was the motion.
Well,
Is
that's a
that not
good
what-
point.
you-
That's a good point.
I just think that will be hard because we're making them stay home, but we're also saying you have to use your
And
sick
your ESSER
leave.
funds, are these going to be for all employees?
Yes, it is for all employees, so it will cover
Cover all of
support
them.
and,
Oh, so
yes,
it's-
so
So-
it'll cover
Okay.
everybody, not just
All right.
certified.
So the good probability is that the ESSER funds hopefully will
We'll cover.
accommodate any of this.
Angie, do you
that we
remember
do.
how much, and we can move some money around?
So did you change that?
I don't
I
know.
know it's aggravating, but it's,
Okay,
It is important because that's a
right.
key point
So-
right there.
so
So if they get the 10, we
So
don't
read that
give them
again.
15
Okay.
more, but-
I'm thinking I may change it all. All right, so the first 10 days for everyone is covered.
Now, wait a
Okay.
minute, the 10 days is different. We're talking about the household contacts.
Well, we've been given the first 10 days to everyone based
And they
on,
do get.
If they're
Okay.
positive.
And household contacts get it also. They
Oh,
get,
do
they get the
Quarantine.
FCCRA benefits during 10
yes.
days.
Anyone that's out for COVID related,
So we're just looking to
we've
balance
been
the
doing
14
the
days.
10 days.
Yes.
10. We're
Okay.
okay.
To balance the 24,
Yes.
so,
Okay.
yes.
Okay, so where are we now
You
then?
may have thrown that piece of paper away.
Yeah,
This is, sorry, this is to be confusing.
Okay, so how, I'm gonna give you what I'm thinking you wanna say,
Okay.
but, okay, approve an additional
Let's say 10.
15 days using ESSER funds following the initial 10 days related to FFCRA.
Yes.
Okay. Approve additional using ESSER
But then
funds.
any days after that, they have to use their sick
That's
or
usually
their.
sick time. That's the way they're doing it
Okay.
at work, and I don't know what I was thinking, that's the way that we do it at our work.
Additional
And it's federal,
days
so.
using ESSER funds on, okay.
So do we have a motion on that?
I'll make that motion.
Mr. Long's made a motion. Do we have a second? And then we'll get into discussion of it if anybody has some questions.
I'll second.
Okay, we have a second from Ms. Reese. Now, any questions left out in this?
yeah, I hate to say this, but can you explain it one more time, what we're approving here?
Yes, what we're approving is if someone is tested positive or they're a contact case.
A household
A
contact.
household contact case, or they may have been a contact case at work. Okay, they go home, they are on FCCRA for 10 days, which is paid leave. It does not impact their sick leave. Okay, what we're saying is because of the new rule in Tennessee where you have to, if you're a contact case at home, you have to stay home for 24 days. So that's, in essence, 15 days, 14 days above the 10. Then we're going to not make them use their sick leave, and that will be paid time. But then anything after that, if they choose to stay home, they will have to use their sick leave.
Okay.
Or unpaid leave, if they do not have that.
Angie?
25,000 already budgeted in ESSER.
Okay.
So with the staff hearing this, we're hearing one thing. Are you hearing something different? Are you hearing the same thing, or is there something that we've said that's confusing? Because you're the ones that's affecting.
Sherry has a really good
Situation.
yeah.
Okay.
I have a staff member that, she's been tested twice. She's been tested negative twice. But her, spouse has been tested positive, so she has been out. She does not have sick leave. I mean, she gets sick leave, and she has some built up, but not a ton. And so she's not gonna get paid.
Or if they approve
If
this.
unless you guys approve this. And y'all know what they make, because you approved that too. Just saying.
It is concerning that, you know, we're requiring them to stay out, but at the same time, like, you know, they don't want to be out necessarily, but they don't have a choice in any of this. So I do think they would be very thankful if you were willing to help them so they did not have to use their sick time.
If they don't get paid, can they not file for unemployment?
No.
Because it's medical.
'Cause, yeah, it's medical if they can't help unemployment.
Okay, any other discussion? All right, call the roll.
Mr. Long?
Yes.
Mr. Matheson?
Yes.
Mr. Payne?
Yes.
Ms. Reese?
Yes.
Mr. Carlton?
Yes.
Thank you.
Okay. Hopefully that will help
Yeah.
our staff.
Yeah.
All right, the next item is the discussion and approval of the Johnson County School System opening plan reassessment due to COVID-19 numbers.
And I do want to share, I have had several emails, texts, phone calls from parents who asked me to convey the message, you know, they want their children back in school, you know, and I do understand that completely. You know, we want our kids back as well. And I did say I will convey that message. I'm sure you probably heard from some of them.
Oh, yeah.
With this, when we shared you 3 different plans. Of course, you know, we will do whatever you all tell us as a board to do. You know, we shared with one, you know, staying all virtual. The other one, option 2, was going 50-50 hybrid, and then option 3 was doing, let's just go back to school full. I do worry about the 50-50 hybrid. I think it will be very hard on our teachers to do both virtual and in person with students. You know, I think our kids need to be back in school. They need to be learning. Our teachers want them back in school. So, I mean, that's the things that I'm hearing. I'm sure you all are hearing the same things.
Yeah.
But, you know, there are some concerns with every plan, no matter what plan we have. You know, it's like Mr. Carlton said, this is an unusual year. So there is no perfect plan out there. But, you know, I do feel like that we do need to try our best to get our kids back in school.
So, but if we do a hybrid, the teachers that have already 2 grades, there is no way they can do that without hiring someone to help them, is there?
It will be extremely hard because they are spending 6 and 7 hours on virtual, plus they're going to have half the kids in 2 days a week doing normal lessons, and then, you know, plus a lot of them are going home and trying to help their child learn. So it is going to be very hard on our teachers. And it's going to be hard on parents. You know, this has been hard on parents, but, you know, this is not what we wanted school to look like this year.
Yeah.
Definitely don't like the virtual world for public schools, but, you know, that's the card we were dealt. So we've done it the best we can, and our teachers have worked super, super hard, I will say that. They work all hours of the day, all hours of the night. So you know, I do commend our teachers, our assistants, our bus drivers, our cooks, our cafeteria, every employee we have they have worked so hard during this.
I'd like to add one more thing to that. People that have been calling me are stating that if we can't put the kids back in school, they want the sports stopped also. They said if we go play sports, we can go to school. That's just what they've been telling me.
So for principals, tell the board how your teachers would do half virtual, half school. I mean, how would you do that? Sherry?
My teachers have been talking in preparation for a 50-50. They'll take at least that. They'll take 100%. Mine will. What they're going to do is the Monday, Tuesday students, they'll teach Monday lessons just like Monday. The kids that are on virtual on Monday will stay virtual. They'll get the same lesson. So they'll keep with the pacing guide. So Monday, Tuesday, the A through K kids will get that lesson in person, and the other students, L through Z, will get it virtually. Wednesday, they are all virtual, and then it flips to Thursday, Friday, but they stay on the same pacing guide that they're on now. They still continue to do what they're doing. And they have Wednesdays to do their recordings, their catch up on their emails and questions asked.
I can't tell the math's on. Are there any other principals in here?
Yes, I think they're all over there. Mark's here.
Like they're all over the corner.
Mark?
Mr.
They're hiding.
Yeah, Mark?
A very similar system, and like Mr. Payne mentioned, it would be difficult with the sixth grade, the fifth and sixth grade. It's a combination where they would be essentially doubling up, if not more, in this situation. But very similar system to what Front Creek is just described.
Okay.
Basically the same.
Basically the
That's
same.
what they're doing. Continuing as is, be in person, and then doing it basically twice.
I think we got Teresa and Leon over there.
Our teachers talked about they would do lesson for the first group Monday, Tuesday, and then on Thursday, Friday, they would repeat that lesson.
The high school, I've heard a couple different options. You know, we're kind of waiting for some more guidance and consensus. But typically, kind of what Sherry had explained, the students at school on Monday, if they were teaching integers, then the students at home would be working on integers as well. You'd continue with your pacing guide Monday through Friday. One thing to consider, I think, is you're still going to have students at home virtually if you decide to come. It's not like all the kids are going to be back in the building.
So you would still have some virtual students. One additional thing I know some teachers at the middle school and the high school had talked about as far as a hybrid is if there would be a possible way, maybe even dismiss them like at 2 o'clock so that you could catch up with those students that were virtually that day, have time to you know, prepare some content and that sort of thing for the other 50% plus the students who have decided to stay 100% virtual at home. Now, how many, didn't mean to interrupt you, Leon, but how many students do we have signed up virtual period?
I do have that number. They got me that today. Right now, we have 315 that are signed up for virtual. I do know that I've heard some parents say that if we come back in person, their kids will be back. I think, Dr. Long, am I right? You did a call today. Is that correct? You've called every one of your virtual people, and actually, you had how many come back?
30.
Say that they were coming back.
How many do you have total?
We had 74 total.
They're at 47 now.
So you're down to 47?
And we have 8 that are gonna come back. If y'all choose 50%, 8 more are coming back. But 8 more don't wanna come back if it's 100%.
The only problem I have is you're gonna have kids that are there Monday and Tuesday, and then off Thursday and Friday, and when they come back in that following Monday and Tuesday, you're gonna have to catch up from Thursday and Friday, and they're from being at home.
No, because they're gonna still be doing Thursday, Friday work. They're gonna do the work every day the same work as if they're there or not there.
And I understand that, but
Okay.
I'll say anything about parents, but we've got some parents that aren't as concerned as other parents are with their students and how they do, and if you're gonna be high school, they're gonna come to school and not have their stuff done. So that teacher's, well, that's,
Because Leon's right, we're gonna have virtual regardless.
We are, and that is an option they still have, you know, and even if they did not sign up for virtual to start with, and they want to move to that because they feel more comfortable, they still have that option. All they have to do is call the principal or call Ms. Miller.
I know I've had some folks call me that have some health problems at home, and they would rather stay virtual.
And they can do that.
And I told them we shouldn't have a problem with that.
Yeah.
The other question I have, Leon, we've got all this sports going on, and you got a lot of kids on the hill with the middle school and the high school. They don't leave a whole lot that ain't there with football, volleyball, cheerleading, band.
It does. I mean, you're talking close to 1,000 students, middle school, high school, football, 40-some students participate, band, 20-some students, cheerleading, 20. So you're talking a lot of students that are not there.
Well, yeah, but you've had a percentage of kids up there, and have you had any outbreaks, or is there?
Well, we've had 40-some football players, and 20-some of them had COVID, so.
That was at the first.
That was at the first of the season.
The
First of August.
Yeah. But so, I mean, what you're asking, there's a lot of kids that's not been up there.
Right.
And just, if you go from no kids in the building to 100% of the, I mean, I know you're not gonna have social distancing.
No.
I mean,
Are you gonna have
50%
social
would be tough.
distancing even if you do 50%?
No, but you'd have 50% more than you would if you had 100%.
Yeah, but that doesn't make any difference if you don't have social distancing of the ones who are there and somebody has COVID, they're gonna pass it.
Yeah.
So we're in the same circumstance, whether you have 100% or 50% or 25%. Dr. Long?
I just wanted to say about a hybrid plan, one thing that it hinges on, because these plans that the principals have laid out, we've talked about them, and I really don't know how else you can do it than to try to stay on pace. Middle school's got a little bit different vision, which is fine, but all of that hinges on them having those devices that they have at home, at school, while they're at school, and that's gonna be a problem, because we're already in a device shortage. You follow what I'm saying? It's gonna be bring your own device. You're gonna be counting on those kids K up to bring that device back with them. Some of them have Chromebooks we gave them, some of them have home devices that they can't tote back and forth. So that's an issue.
If you're in school, if you've got students in school, why do they need their Chromebooks and their devices?
Right.
Well, based on the plan of keeping that pacing, they're gonna need to use those same platforms even while they're in person. They'll just have the benefit of being in person.
You're talking about it at the when we're talking about hybrid.
Yes.
Not in school, 100%. Yeah, you're talking about
And
hybrid.
I'm just trying to give out relevant information. If we were to come back at 100%, which isn't 100% because you still got the kids that opt virtual, then the devices come back with them. And the teachers can keep doing their thing.
Yeah, the teachers want to continue.
The devices are an issue.
Yeah, they've got to get things going now, and they don't
Well,
want to.
the other thing, if we do go back 100%, would there be some coaching with these kids to help them on this virtual platform? Because I'm still getting calls.
Yeah.
Oh, yes, because they would be in person, yeah.
And they'd be there to coach them, say, if we have to be out next week, or if we're gonna be virtual fall break, this is what we're gonna do, and you're gonna learn it better, or do better.
And we are still waiting on 11 or 1,200 Chromebooks. When they get here, we'll be all the more prepared for that, if that were to happen again. So hopefully that happens sooner than later.
Is there an estimated arrival date on those?
No.
No.
Rob's shaking his
Hopefully
head.
2020. You know what kind of year that is.
Wendy, let me ask you a question. We've talked around it, but the same point to Leon. Whether you're 25% or 50% or 100%, the kids are not going to social distance. Being 6 feet apart is not going to make any difference. if somebody's got COVID and they're not wearing a mask, or they're touching something, or they cough into their hand, what's the difference? Where are we, what is our situation if we have 100%, or if we go 50% health-wise? Because you still got all these people in the building, you still got people touching things, and that COVID is so contagious. So, I mean, if we decide to go back, what's the difference between those plans? Because you're not gonna keep those kids separate.
No,
We're
I
not
mean,
social distanced in here.
I mean, it's just basically you just have half to deal with, really. I mean, that's, medically, there's probably not anything. I mean, you just have less that's coming to the clinic, which I want to discuss some other things about that we're having to see. And
Well, there's still that common denominator. You've got your teachers, you've got your janitors. So right there, they're gonna be with both groups. You've got your, people in the cafeteria, they're gonna be at both groups. So if you have a kid that tests positive, then everybody that's in contact with that teacher, and anybody that they've been in contact with at the school, whether it be a janitor, a cook, or whatever.
One other thing I think that's relevant about social distancing, I'm sorry, I just want to throw this out because it's there. Not all classes within a school are evenly spaced, A through K.
No.
And L through Z.
Right.
So, you may have a class that 75% of the class is named Adams and Birchfield and Campbell.
Mm-hmm.
And so that class is gonna be full that day because they're A through K, you see what I'm saying? And you won't be able to social distance that class anyway. Again, just.
Wendy, did you have some more to add to our discussion?
I do.
Go ahead.
If anybody, I mean, I hate to throw the wrench in there, but I just wanted to kind of update you on our numbers, and then I had a few little handouts I wanted to go over, because we did get some new recommendations, since we had our last board meeting. I'll just go over it first, because it kind of plays a little bit more into what we're talking about with the contacts, but on the first paper there I gave you, it's updated information since 8/22 and September 2nd, and on September 2nd, they changed the requirements. Well, it used to be 10 minutes exposure, now it's 15. So it was 6 feet, 10 minutes, now it's 15. And then the rest of that's pretty much the same, except for bullet number 4. And this is kind of the big one that kind of puts, I've got some of the the nursing staff here in case you have a question regarding clinics, but they decided to add that we cannot exclude seasonal allergies and allergic rhinitis as a list of diagnoses or symptoms that would exclude COVID-19. Now, I've had 1,000 calls this week about that, because every single person, just about it, has seasonal allergies right now. Okay? So I've had to actually send home and quarantine some that's had these symptoms, because technically they're symptomatic with COVID-19 symptoms. Until they go test or get an alternative diagnosis from their physician, I have to exclude them.
But they can go get an alternative diagnosis, or they can go get a test.
Which it can be like sinusitis or strep throat. Now, even though, like we talked before, if you have strep throat or the flu, because those symptoms are similar, if they test negative, they still have to go test. The problem is, and we've been talking with Dr. Piercy and Dr. Kursky about this, that's going to be very difficult, because we're going to be excluding almost everybody initially, because as soon as we go back, we've got all these runny noses and all the allergy symptoms. And they're all going to be coming to the clinic, and I don't know how we're going to see that capacity, number one, within try to get people out of the room without being in contact for 15 minutes. And I was thinking about this the other day about how to do that, but I had a call from a teacher last night. It just made me think about it a little bit more. Every person that I've had, and not all of them has been positive, but the teacher said, Wendy, honestly, I had a scratchy throat all week, and I honestly thought it was my regular seasonal allergies that I had, and they tested positive. So they were taking, school pretty much Wednesday, Thursday, Friday. So I had to go back and contact trace people that had been around that person for 48 hours which luckily this round wasn't very many. But the seasonal allergy thing just throws a major a roadblock for this.
The overkill is that if you've got masks and you're washing hands and keeping things clean, the likelihood of you passing that's slim. Because I've had staff that have been at work with masks and gloves and been positive and nobody around them caught it. So, I mean, it's a little bit of an overkill, the fact that you got a runny nose and all of a sudden they look at that as a positive COVID.
Well, they're not saying it's positive COVID, they're just
as
saying we
a
can't exclude.
potential COVID.
We
I
have
didn't
to
mean positive.
exclude, but initially, until we have a valid diagnosis otherwise, is what they're saying, so.
And this is, you know, just to clarify, this is a recommendation from the Department of Health. You know, it is not a requirement, it is a recommendation from them.
I'd like to follow up with what Wendy said. That's a big concern at Mountain City Elementary, because if you look at our data from last September, my nurse saw almost 700 students in the month of September. And so if you look at that, plus what's going to be going on this year, and you know, it's almost like you're going to have to put 2 or 3 people to help her, because she's going to be in her clinic, and where do these students come? Do you leave them in the room? Do you remove them? Do they line up and wait? Once she sends them to the isolation room, you got to have somebody to transport them to the isolation room, because she can't leave the clinic, you know, to do that. And then you've got somebody to stay in the isolation room with them until they're picked up. And who stays in the isolation room? How do you choose a person to do that? So the clinic issue is a big issue. We want the kids back like everybody else, but this is just reality that this is going to be a problem. You know.
And I want the kids to go back too. I'm just saying that this is what the Department of Health put out. The third paper there does give you the algorithm that we're supposed to follow. And, you know, you can get them back quicker. It's not saying I'm putting them out for 24-day quarantine. It's saying if they have one low-risk symptom, you know, that might be the scratchy throat, you know, they go out. If they have improvement in symptoms, they can return 24 hours. If they don't have improvement and they continue to have their allergy symptoms or progressive worsening symptoms, then they have to go get the testing or see their healthcare provider, and then we just follow the algorithm. So, I mean, they're not going to be out 14 days. They're going to be out probably more minimum, less, you know, the closet. The thing is just that's an extra roadblock, like I said, that kind of puts the health services staff in a bind, because, you know, the teacher's going to see them in they could possibly have it, possibly not. I can't determine just by looking at them with those symptoms if they have it or not. We have to do the algorithm, get the testing, whatever.
Well, we need to start by looking, we've got to start somewhere.
I agree with that. We have to start somewhere.
And you might as well just get ready. Mrs. Long's plan back there, I like it. Let's go back, and I'll make a motion that we go back 100%.
Okay.
And in 2 weeks' time, if the numbers don't come up on COVID, then we're okay. If they begin to climb, then we'll go back to another alternative plan.
Okay, if we do that, do we need some more staff to help with issues like Ms. Triplett just said? I mean, would that have to be, I mean, if the nurse is going to need help, do we just need medical professionals to do what she was talking about, or just?
We did put 2 additional nurses. Is that right, Angie? One additional nurse in our, that's funded through our CARES Act. So we already have that in there, and they're in place.
But I don't think that's enough to do what.
Well, and that's on the Hill, because, you know, it was not fair to Karen to serve 1,000 kids on the Hill, because, no, currently she's the only nurse on the Hill. So we did add an additional nurse to the Hill to help with, because, you know, of course, that's where the majority of the students are.
I think they're starting out at Laurel. Laurel doesn't have a nurse, and then they'll be going to the Hill.
Now, are we assuming we're gonna have an influx of patients here coming to the nurse's station, or?
That is what they are assuming, because, you know.
Because of allergies.
Because of allergies, because
this
of
thing right here.
this recommendation.
We can't work off of assuming. We've got to have fact, okay? So let's start somewhere.
Well, you're gonna have
Well,
more,
I mean,
you're gonna have more with this health guidelines, and the health department's almost like they're not wanting anybody to start schools, that they're making it impossible, but the other problem's gonna be flu season coming up, because flu mimics COVID too.
We
so.
talked about getting flu test, is that?
We actually had a call on that Tuesday with the flu vaccines, so we are still working on the flu
Well, he's
vaccines.
talking about the thing we talked about before, if I couldn't get
Yeah.
them through EMD, if we were gonna
Oh.
charge this extra flu test to be able to
Right.
validate that they had flu or not.
Yeah.
Did you,
We never actually, I don't think we actually said yes or no on that. Last
why
time
don't we
we
say
did.
yes, get them?
well, do we have to put that in motion?
Yeah.
I would, and
Or
then we
we'll,
can
we'll handle
figure
it
out a
first.
way.
The other question I have, well, that's several questions, but, we're gonna go back, you know, if we go back to school 100%, I know we've got this policy of missing 10 days. Now, how are we gonna deal with that? If we're gonna send them home, they can't have that, we can't have that policy.
No, we can't, and you know, I think that's one thing the board's gonna have to understand. I wish the State Department would get rid of chronic absenteeism for the 2021 school year, but they are not going to. But I do think that's something we're gonna have to realize as a district, that those numbers that the state provides us next year, our chronic absenteeism is going to be very high.
There's nothing we can do about it.
But there's nothing we can do about it,
Right.
you know, and we're saying if your child's sick, you keep them at home.
But if
They
we
shouldn't
have
be
that
punished
virtual
for that.
option, they can go home and log in virtually.
They can go home and log in virtual. Right now, the kids that Ms. Miller is targeting are those kids that have done nothing for 2 weeks. They've done home visits. They're refusing to do anything. That's the kids they're gonna target with absenteeism.
2
Not
weeks,
those
there's
kids
kids
that are
that's
being
not
sent
done
home.
anything since March, and I bet you'll shake your head, right?
Yeah.
And another thing, if we do go back 100%, we need for the first couple of weeks not to be too hard on the students because they've been accustomed to being a little bit lazy, you know, right?
Yeah.
Going to school.
Our teachers will do a good job of that.
Yeah.
They understand this is gonna be a
Watch.
transition. They've not been in school since March.
You know, marking them down as being absent, and things of that nature.
Yeah, the other thing I had was, if we go back 100%, I know we ain't gonna go tomorrow.
No.
How long, we've got the principals here, how long do you
We need a few days.
need to be ready to have students in the building?
Okay,
Wednesday of next week, Thursday of next week?
Could you start Monday of next week, Ms. Long?
Well, I've had 82 students in my building every day, plus my employees, so I can't speak for anybody else. But
Well, I'm just-
Thursday's fine. I mean, I think that's what they had talked about, maybe, is starting Thursday, just to give the teachers some time to get things together, but, I mean, they've got their plans.
I honestly feel like if we do 100% full, I think we could start Wednesday. That would give time for our teachers to prepare. Kids would still be doing virtual learning till Wednesday.
Mark, can you go Wednesday? Gay, could you do Wednesday? Now, back to my question. Are we gonna have to hire someone to help our medical staff?
We may have to do it.
Wendy,
I think so.
how many
because
do we need?
We see normal 40 kids in a clinic each day, and that's on a normal day, which is way above like a clinic's normal standard, and then you got this coming on, which is gonna triple it, I think, but.
And on a legal standpoint, we can't leave a student alone, so that's why we need someone, if not in the room, at least being outside the room of the isolation room to wait for a parent to come. And medically, that is just a lawsuit ready to happen if we don't have someone with that.
Does that have to be a nurse, or can
No.
it?
They don't have to be a
No,
medical.
it doesn't have to be a
Just
nurse.
be an employee, as long as it's an employee of the county.
Right.
How many temps do you need? How many? One for each school? Is that enough?
I mean, that's a start.
Yeah.
Let's put that in motion.
you never
Is
ask
that
them
okay
boss,
with that in your
nobody,
motion?
staff, they're always gonna.
Add that to
Or I'm
Gary's
gonna say-
motion. Or can we do that? We need to add that to Gary's motion, we need a separate motion.
I think we
I'd
can-
say add it to Gary's
I'd say
motion.
just
Add
make
to
it
Gary's
one big
motion,
Is that
it's
okay with
okay?
you?
Yeah.
Approve.
So what was that we were adding, one per school?
One full-time.
Full,
That's a temp, right?
100%.
Now, the issue too,
on
the-
Wednesday.
building on what Mike's talking about, what about nursing staff?
Are you good?
Like, for instance, at the high school, Do you need an extra person at the middle school? Or like at Mountain City where you got larger numbers?
We could probably use another one at the high school, and probably, what are we at Wrong Creek? For what? Mountain City's got more than Wrong Creek does.
Yeah, Mountain City's the largest elementary, they have almost 500.
So how are you gonna propose to do this if we hire all these new staff?
We will make it work.
I like that answer.
We always do.
I know that we-
Because if we have help, you know, we
Yeah.
can manage it.
One more question. Darwin, Stephen, Herbie, are y'all ready?
Yes.
They can be ready by Wednesday.
So how do we do school buses when you go back to 100%?
How you gonna clean them?
We've got, the spray bombs that we set off to disinfect with. Plus, we've got the chemicals that they spray and wipe down the seats. Hand sanitizer on every bus for the kids and masks for the drivers.
Students be assigned a seat.
Assigned seats for everyone that's in the household.
Is the driver gonna
They'll be
be,
grouped together.
driver's not gonna be responsible for taking the temperature?
No.
Thank you.
What about masks on the bus? It says that they're gonna be required. Is it gonna be
Yes.
required on the bus now too?
It will be
Is
required.
that correct? Okay.
Well, after driving a bus, I don't know that you're gonna keep a mask on a kid that don't want a mask on a kid.
Well, I understand that.
I don't know how the
but-
discipline part will work
I
on
don't
the
know how
bus,
that's gonna work,
but
but-
once they get into the building, then we will.
You know, I think it's just something that they're gonna have to learn, that this is what we have to do, and children, and, you know, they're not accustomed to it, we're not any accustomed to it, but I think that they can learn it, and they know, children usually, most of them, the smaller ones especially, if you tell them this is the way it has to be, I feel like that when they get accustomed to it, they'll do it.
And they will. If they want to be back, so.
I was gonna say one last thing, just for the record. I just want parents to, you know, be prepared, because, you know, just if we come back, you know, if we've got someone symptomatic,
We're gonna go back home.
they're coming home.
Right.
So don't just be like, I'm not coming to get them for 2 or 3 hours.
Right, and one thing we need to stress, because we've talked about this, is when you get the call as a parent from the nurse saying, come get your child, you need to come get your child then. You know, we can't have them just lingering around all day long. That is very important, because I know sometimes, and nurses, you all know this better than anybody, parents sometimes take their time to come get their child, but we need them to come as soon as they can, just to help
I
stop.
guess a letter and a call out will be,
Yes.
that'll be included in that. He's got a motion, I'll second.
Okay.
One thing, I mean, we are gonna do a dashboard. Do you wanna explain it? Because I mean, you know a little bit more about what we're gonna do with it.
So we're required to, if there is an active case in the school, we're required to notify parents. And so we feel like that we would just be sending letters home, you know, every few days anyway. So other school systems around us have created a dashboard, so we're in the process of doing that same thing. It will have the new active cases per day, the total number of students and faculty that are in isolation, and then the number of students and faculty that are in quarantine. And we will update that daily. Lori's gonna update that every day for us.
Is that the same thing the state has out, that you can see any case anywhere in the state of Tennessee,
Right,
any
I
school
think the
system?
state is only updated weekly.
Yeah, I'm in charge of the state when we only have to update that weekly, every Monday.
That way we don't have to send all those letters.
Right.
Okay.
Parents send it every day. If it's been reported to Wendy before 3 o'clock, then it will be updated that day.
And
Monday through Friday.
we still will be doing food. However, it will be different. I mean, for those virtual learners, they have to come to the elementary schools and pick up those foods.
Are we still going to do that 100%?
Yeah, because we still have kids that are virtual, so we still have to offer that for our kids that are enrolled.
There's something else. Is Kathy gonna need help? Can your staff handle that?
I mean, as long as, you know, I don't have staff that starts dropping off. If I do.
We'll just have to do it, see what happens.
Well, they've worked all this time anyway, mostly though, haven't they? I mean, that doesn't mean that they're not going to, but they have worked for the most part the whole time. Right. Wendy, do we have any active cases? That was one thing I was gonna ask earlier and I forgot, that we know of in the system right now.
have 3 positive staff and 3 positive students. And then there's some of those are household contacts, and I do have about 6 kids on quarantine till October 2nd.
I think one of the really important things is when everybody comes back is to reinforce the fact that we're back with restrictions. Because I think a lot of people are gonna come back thinking we're just wide open and doing whatever, and we need to still make an emphasis on the fact of how contagious and how possibly deadly this disease is. And the other, well, I just think we need to make that important. You know, like I say, I've dealt with staff who have had tested positive and been around all of us, but the fact that we took proper precautions, we didn't catch it. So the important thing is not just getting back to school and having kids sent home because they got a runny nose and we're putting them in that category, but it's the fact that we don't get people actually with coronavirus and taking this home and having people sick or potentially die.
Right, but I have had 3 staff and actually 2 parents that had severe respiratory stress and went up in the ER over the last couple weeks. So I do want everybody to take it serious. So move forward.
I've had family members who've been on the vent, and they called the family in. Fortunately, they lived, but they're still not full strength, so it is critical. All right, so we have a motion. That motion is to return to school 100% next Wednesday. Included in that motion was that we would add an additional person to each clinic. Doesn't have to be a medical person to assist with monitoring those students who they put in isolation.
I have one question about that person. Who will do the job description on that? Because
That would be Wendy.
okay, because you take someone at Laurel, they might not be very busy. Could we let the principal have them part of the day if you didn't need that person all day? Because they might need to do some extra cleaning or something. Because I know Laurel just got one janitor down there. Huh?
That's fine with me.
But if there's someone in isolation, I know they can't, but just bear that in mind, if you don't mind. Do that?
Okay.
Okay.
And I think, did I hear that in part of that motion was that we were gonna allow Wendy and the director of schools and I guess the supervisors to get together to determine if a school needed an additional nurse, given this workload?
Yeah.
Okay.
You got a question?
Okay with you?
And that we monitor this thing closely for the first 2 weeks.
Oh, yeah.
But I don't think I've represented my staff quite like I should have. We met today, had a Zoom meeting, and they were concerned about coming back 100% because when we were talking about the issues with 50%, I just asked them, I said, well, would it be better just to come back at 100%, just for us to discuss and talk about? And we have several teachers at our school that have compromised immune systems, due to diseases that they're fighting. And there was no one that wanted that. So I just feel like I need to let the board know that. And also, if we still have virtual, are we thinking about allowing some time for teachers to plan for those virtual students that they'll be serving? Or is this 100% 5 days a week, regular schedule?
Because they're still gonna have to plan for this virtual, have some virtual time.
And I think that's something that we'll discuss on our call tomorrow. Because again, I don't know how many of y'all did the call like Sherry did, but just by calling, she has 30 that's saying, no, I'm coming back. So your numbers may drop on the ones you have on virtual.
Well, I think when we first started discussing this a month ago or whatever, somebody, I don't know if it's Sherry or who it was, that said, adjust some free time during the day or something. Was that somebody?
I think Sherry had
Plan
had done a
time.
plan where she was going to use her specialty teachers to give additional planning with.
You won't be able to do that? Okay. That was just the hybrid schedule. Okay.
One other concern the teachers had was about wearing masks you know, to what extent can we enforce that? Because we've already experienced, you know, students that don't want to wear a mask just to come into the lab. So, you know, how would we enforce that students wearing a mask?
So you send them home.
That's what we've been advised to do. If they choose not to wear a mask, we provide them one. If they still say no, then we send them
We can
home.
set the rule.
I mean, that's what McCarty has said, and that's what other school systems
I
are
mean,
doing.
the issue is, irregardless if we go 25%, 50, or 100%, the fact of if you don't protect each other, then we're gonna spread this all over the county and it's gonna be everywhere. You know, we can talk about the prison and the fact that they've got 69 plus, inmates who tested positive. They've also had some staff. Well, those inmates testing positive, there's a lot of staff who work there who are parents and who are out in our community. So that gets passed around all these different ways. And for your teachers, and I share their concerns. I mean, I don't know that any of us think that what do we do? Say virtual for the rest of the time? Most people don't want that from what we hear. Do we say 25%? Do we say 50? Do we say 100%? I think that anytime you do any of that, there's a whole group of folks who say that's not a good decision. But again, my point comes back that, number one, whether you're 25% or not, and let's say 25%, your compromised teachers can still be compromised by one student who comes in there who's positive.
Exactly.
If they don't keep everything like it should be. And number two, if we don't enforce that mask, and I'm telling you, I've had 3 nurses test positive for COVID, working around all of us in close confines around inmates. We didn't get it because they kept masks and they kept their hands clean, and of course we wear gloves. But so those 2 things are going to be critical to this whole plan. But again, I share your concerns. I'm concerned whatever we do. But going back 25%, 50, or 100%, and nurses, if you disagree, but I mean, if you got 25% of your kids there and they're sick, and we don't take precautions, and they pass it, just like Mr. Payne said, and that teacher's gonna be the same teacher for this group as this group, all of a sudden, we're in the same boat. So we just gotta make absolutely sure that we keep those restrictions in place.
Wouldn't that ease the burden on the nurses as far as the number of students that were seeing the nurse if we're doing 50% back?
Well, but what's the burden gonna do? I mean, I don't mean to control this conversation, but what does the burden do to the teachers who gotta teach virtual and the parents who've gotta have their kids home virtual, and also the nurses, and also the, having in-class, virtual class, kids at home? From what I'm hearing I haven't heard anything different, is that the younger kids are really suffering.
They are.
That's where it's all coming from, yes.
They are.
So I'm gonna vote, but I'm gonna tell you, I don't think there's a good plan.
There's not a good plan.
Either way we go, I don't
But
think
our-
it's a good plan.
But our main responsibility here is our kids, and they're suffering from being at home. They're not getting their potential like they should. If they're in school, I feel like they'll get it better. I just don't think the virtual for the younger kids is a good deal. I just don't, from all I'm hearing.
Well, even the older ones, when they come up to something, they just open up another tab and going to Google and Googling the answers. So,
The average age that I'm hearing from is from 4th back to K.
Having trouble.
That's what I'm hearing.
yeah, you're right.
And that's why I think they need to be in front of that instructor.
We've all gone to Walmart and gone out to eat and things like that. We can do this in school. We just got to make sure and just know that the board is behind you. When you send that kid home and that parent calls, the board is behind you as far as we're not going to tolerate that. Because we gotta do something. And we can do this. We can do it.
And we still have the option for virtual, for those.
I think you're missing, one other option for virtual, but I think we still need to think about building in some time for the teachers. If you got if my kid's home virtual, they're just as important as your kid home in school, so we need to think about filling in some of that time, somehow for the teachers to plan for those kids that are virtual.
Well, looks like it, you know, am I wrong? And it should be planned for next week if we vote to go stay 100% virtual, huh?
You're talking about maybe planning for a day or two. Those kids are gonna be virtual for a while. You can't make plans for the whole semester.
How much time do you need? I mean, what are you talking about? Just,
Well, they need, it just depends. I don't know how much time they would need, but they would need either time built in there in the day or a day a week.
I think he's saying
oh,
additional, I think that's
So-
something we'll talk about tomorrow during our call.
can,
Yeah, I
I
would
mean,
leave.
can we dismiss school early, say at 2 or 1:30, whatever that time
We don't
was?
meet the state required
Hour.
Time.
hours.
You ought to be there then.
State's giving us a hard time
That-
dealing with
that's the problem
coronavirus
with
and all
that.
the rules.
Yeah.
And then you have to do the testing too. I saw that they're gonna require the testing and not
Yeah.
give you any leeway because they want you back in school, but I think that, I agree with Leon, but I think that's something for the managers and the central office staff to come up with and
Yeah, we can't work that time.
Yeah, because
encouraging Dr. Simcox to, you know, try to make some arrangements.
Yeah, I
for
wish we
that.
could dismiss early and give them that extra time, but state law, we can't. We have to have them sitting in a seat.
And I just want you to know, Teresa, we talked about that today, but the number one job of an administrator is to keep their staff and students safe. So I just want you to know that's kind of where we stand on, you know, that's our number one job, keep your staff and students safe, and then we educate them, you know, so. And I agree that we need kids back in school, but, you know, it's your decision as far as what capacity.
I wish it wasn't. Any other discussion? All right, so we have a motion. Would you read that motion back to us?
Yes, approve returning students in person to schools 100% on Wednesday, mask required, allowing for additional staff to assist school nurses at each clinic, with Dr. Simcox and supervisors to decide if additional staff are needed, with the virtual option still available.
That's Wednesday the 16th, correct?
Correct.
Okay.
And you had the second on that, right?
I had to say.
Mr. Long's already
Yes,
seconded that.
Mr. Long, I
All
have
right.
first and second.
Anybody have any other discussion? All right, call the roll.
Mr. Long?
Yes.
Mr. Matheson?
Yes.
Mr. Payne?
Yes.
Ms. Reese?
Yes.
Mr. Carlton?
Yes. All right,
It's another one of them votes I dreaded for a long time.
I almost think we need a break after that. All right, director's report.
Well, mine is really short and sweet. Just to let everyone know, we do have masks that we got for all of our students and our staff. And I don't know if you can see the school board members, they have one, it's got a longhorn on it. So those will be given out to our students and our staff on Monday, our students on Wednesday. So, you know, you have the mask, so just wear it so we can stay in school. And thank you, school board, for allowing our students to come back. We do appreciate that. And then just a reminder, Monday, as you know, our TSBA Fall District is now virtual meeting. So if you've registered for that, you can watch it at home. I'll be watching it from my office. So I think it's from 5 to 6.
You know, did Serena register us or?
Now that
Register.
I don't know. I will.
You have to register yourself.
I had to register
Oh.
myself for that
Yes.
one.
Oh.
I had to click on the link.
Oh, okay.
Yeah,
With that email, I think.
because it said
And
register here.
Then she sends you one back, and then they will send you a link before the meeting to
Okay,
get on.
and that's for this next Monday.
And just so you know, Sharina got a call probably 5:30 that her daughter's water had broke, they thought.
Oh.
So that is why she is not here, so
Okay.
she might be a grandma by
Be a
now.
grandma
Or
by now.
And she is 5 to 6 weeks early.
So please keep
Okay.
them in your prayers.
Well, have her
And
talk to
then
my daughter.
next Thursday is School Bus Driver Appreciation Day, and they have worked really hard. You know, they've still been delivering meals even when we were out in March, so we appreciate all they do. And so that is next Thursday. So if you see a bus driver, please thank them. And that's all I have.
All right. Mr. Matheson, you have anything you want to bring up?
No, I'd just like to say that it's been rough for the last couple of weeks hearing from people, parents, about getting their kids back in school. And one of the biggest things I've heard was, if we can play sports and stuff, then we can go to school. I don't have nothing against sports. That's a good program. But there was, again, they were complaining, if we're having sports, why can't we be in school? So I hope this will please a lot of families tonight.
Mr. Payne?
Yeah, I just want to appreciate everybody, all the hard work. I know it's going to get crazy next week, so hang in there, it'll smooth down. I hesitate to bring this up, but it's like beating a dead horse here, or just keep, I don't want to be complaining, but this was asked of me. The day, we can have 3 short days, right? 3 half days?
Mhm.
What about making that?
We've already discussed that. I think I know where you're going.
Alrighty?
We actually discussed that today. Normally, our first day of instruction is a half day because we can have 3. So what we talked about was making the Wednesday before Thanksgiving a half day. Is that where you were going, Mr.
That's
Payne? I
exactly,
read
you
your
read
mind.
my mind.
Yeah, we
Okay.
actually talked about that today, so Ms. Miller's working on submitting that to the state for approval.
Okay, so, all right.
And just, if I ain't badly mistaken, that was asking in a board chairman thing that I went to years ago, why we have half days, and I think it's to do with Memphis and West Tennessee, the half days. I don't know why we have to abide by them, but that's all right too.
Ms. Reed?
Okay. All right, that's all I got.
I just want to say I appreciate everything that everyone does. I know everything's been difficult, it's been different, and worked really hard, but I do want to say that I appreciate all of you.
Mr. Long?
I know it's gonna be a challenge, but I know we can do it. I know y'all can do it. I don't add myself in that. I know y'all have to deal with it, but I feel confident that we're gonna be all right.
Well, and again, I think we just want to express that you have our support. I know this is going to be difficult. We've made some extraordinary decisions tonight as far as paying folks for time and adding staff to accommodate this. And, again, I think all of us support you. And if you need something, let Dr. Simcox know, and, she can relay it back to us, and we'll be there to support you on things. Let's make this work. It can work. We're going to make it work. And this has been a hard decision, and I don't think there's a good choice.
One more thing, don't mean to interrupt, but do we need to probably meet in 2 weeks to look at this, or think we're good to go a month?
What if we do, what's the pleasure? I don't know.
I think we need to look at it maybe in a couple
2
of
weeks.
weeks and see what things are
Schedule's
looking like.
2 weeks.
So if you'll email everybody and let us know.
Okay.
A day, I'm just about any day, so.
Just a called meeting?
Yeah.
Yeah.
All right. If there's no other business,
I'll make a motion, we adjourn.
meeting's adjourned.